So how does carbon dioxide carboxytherapy improve skin collagen and skin elastin?
At Skin Renewal, we combine doctor-led care, cutting-edge technology, and a holistic approach to deliver personalized solutions that truly transform your skin. Just what you need right now.
So by placing this medical grade carbon dioxide into the skin, a whole cascade of growth factors, arrives at the area where you've placed the carbon dioxide, and it increased circulation to the area, which is great for under eye area where you have very poor circulation, because it releases a growth factor that increases circulation. And the beauty about carboxytherapy is that each treatment is a cumulative, so you can actually have it weekly if you want to shorten your treatment time, or you can have it every 2 to 4 months, and obviously that's going to take a bit longer. Every time you put the medical grade carbon dioxide into the skin, you increase the growth factor called VEGF, vascular endothelial growth factor, and that increases the blood supply to the area. So it's great for under eye area because we know with aging, and we know the under eye area has a very poor vascular supply and lymphatic drainage. And then it's excellent for hair loss, because anything that increases the circulation to the scalp is going to improve hair growth. So by injecting tiny little bits of carboxytherapy under the scalp, you're increasing this growth factor that increases blood vessels to the area. And then, for circulation and for cellulite, we know that cellulite has multiple mechanisms that need to be addressed. So you have very poor skin texture, and that we can do. We can do carboxy over the area to improve the skin texture over the cellulite areas. So there the carboxy would be put very superficially. And then we know that cellulite has very bad lymphatic drainage. And we know how important lymphatic drainage is for the body. And there we inject carboxy in 4 different areas along the leg. Actually, I find it quite painless. We inject the carbon dioxide to kickstart that lymphatic stimulation, to improve the circulation to the lower leg, and then also to improve circulation to the rest of the body. And then it also increases a bad blood supply to the leg. So by doing it, once again, you're increasing the venous circulation leading back to the body. So carboxy has poor venous circulation. And then, so it's collagen, venous circulation, and very often you have like little fatty pockets under the skin. So by injecting deep into these fatty pockets, you put like the needle, the needle's not really very long. You can actually break those fat cells down and improve the texture of the skin and take away that lumpiness of the skin. And the very fact that you're injecting carbon dioxide under the skin, you are disrupting those fibrous bands that tether the fat down and cause the cellulite look. So as I said, we have many benefits from introducing carboxytherapy, for cellulite along these lymph drainage points and along the lower legs. So we have one in the inguinal canal here. We have one behind the knee. We have one just behind behind the major muscle on the lower leg, and then one at the ankle. This is where we inject tiny bits of carbon dioxide therapy. And then once again, the beauty about these treatments is that it's all accumulative, because you're increasing all those growth factors that improve circulation to the whole of the lower limb where you have injected. And it just builds on, each treatment builds on one another. So you get this accumulative effect. And then obviously everything's not a sprint, it's a marathon. And then every 2-3 months, once you've done your 8 to 12 carboxytherapy sessions, you would have to maybe do maintenance every month or every 6 or 12 weeks, just to keep that circulation going, keep those growth factors pumping into the area to improve circulation to the area. And then if you combine it with our radiofrequency treatments, once again, we have the synergy between two treatments stacked together. You have a much greater amplification effect, because the radiofrequency actually tightens skin and also stimulates collagen and elastin and improves the texture of the skin. So there you have 1+1. And then afterwards, we add like a cellulite gel, which just improves the circulation even dramatically. So that combination is the real go-to for cellulite. And together with, life coaching, lifestyle coaching to help you prevent the cellulite in the first place. So carboxytherapy combined with other treatments is just complete amplification and synergistic effect of the treatment.